be in place. So therefore, if the attestation is from the alcalo, that needs to also be endorsed. Alcalo's attestation should be also be endorsed by the district chief. That's a protocol. But registration is based on a legal framework, and the protocol is saying that attestation must be endorsed by the alcalo. So some of the people find it difficult to say once the alcalo endorses it's enough. No, it's a requirement. It's a legal requirement that says alcalos attest and endorsed by the district chief. In the municipality here, some will say the district chief is not available, but the those in the same functions, that's the mayors, are the same functions as we said. Mayor's office endorse those documentations. And once you have this, you're automatically qualified and you should be given, unless if you're a minor, the minor should be accompanied by a guardian or parents. Less than 18, you cannot register yourself, that's illegal. You need to go with them, and then they need to be at the registration centers for them to be registered, because it's an electronic and your facial image need to be captured. So therefore, one should be at the registration center to be registered and issue the certificates. And then, as I have been mentioned earlier, this registration is free of charge. The Gambia government is not looking any benefits or financial benefits in terms of documenting its people. That's why it has ever been, since colonial time to now, the registration has never passed $15. The maximum pay that people are doing now up to today is $12.50 if it's a regular registration. That's for, even for late registration. For under 5 is free of charge. So basically, the production fee is not even charged for those documentations. Much more this electronic one, which we started now, it is totally free of charge. We're giving it to all eligible individual Gambians born in the Gambia or resident born to Gambian descent. If you're born outside the Gambia, to a Gambian parent, you are also entitled to be registered and be given a birth certificate. If you're born to non-Gambian parents and born in the country, you are also entitled to be given a birth certificate, because the Gambia had also ratified the conventions, international conventions on the right of the child, CRC, CEDAW, and all other protocols, and also convention in terms of against human trafficking. Therefore, every individual must be documented, and this cannot be done with children born in the country when they are not documented. So therefore, all those ones are eligible to be documented, and they need to be given a birth certificate, and it's all free of charge. Refugees born in the country, they need to be registered and given them. Only people who are born, if you are a refugee, you come as a young man, as a refugee, you are not to be registered and given birth certificate. That one, the High Commission of Refugee Commission should register you and classify you as a refugee that come into the country as a minor. Only those born in the country and only born to a Gambian outside the Gambia. These are the only people who are entitled legally to be registered and be given a birth certificate. For the national health insurance, every individual resident in the Gambia, whether you are a respective of a Gambian, but once you stay here for a period of 3 to 6 months, you are entitled to be given national health insurance, which we are also given. Cards are the ones we are giving, and we are giving them free of charge. Although the service is yet to be determined by the authority, who will know how nitty-gritty involvement of the premium and others, they will clarify that one, but we are here to provide a base for them. The card need to be issued, which when they activate it, then that's the time you're able to have access to those services. Basically, CRBS has come to stay. That is, civil registration by the states has come to stay. Is the modernized name given to birth registration. But CRBS is beyond only births. It's also, sense of identity and a sense of belonging, the human rights, inclusive of all this, and also collection of the data that will be used for planning purposes, and also ensuring that our country is safe and secure. So these are the one basically what CRBS has come for. We've been doing that before, but now we are doing the electronic one. The issue is this way. Now we are doing the campaign. This mass registration is to start a baseline that we're able to enroll people as many as possible, replace their old birth certificate with the new one. That we're replacing old birth certificate with the new one. So one shouldn't stay to say that I have my already good old birth certificate with me, so I don't need to register. No. Old birth certificate, irrespective of what age, should be replaced with the new electronic registration that we will have, so that the country will have a comprehensive database on each citizen or people in the country. And then without this, again, if you come back and then your data is not found in the old archive or so, you become a victim of yourself. So therefore, it is necessary for every individual to come on board and register and replace the old birth certificate with the new electronic civil registration birth certificate that we are issuing now. The phase 1 and 2, phase 1 is the one that we're doing within these 3 months. And even within these 3 months, we realized after our first week in some of the areas, we need to come back because the demand was more than what we were able to supply. That has been due to the nature of internet, which is beyond the program's level. We don't have fast internet, and the system is based on internet. All the features are based on internet because it's electronic, and it's also linked to other sister programs. It's linked to national identity programs because it generates need on spot, and it incorporates the existing need on spot. And this need to be linked to the other sister database that is not with CRBS. So therefore, if you don't have the internet, you don't have that connection, and that delays people queuing for a while, waiting for internet. And what the program have done is to provide adequate queue cell routers and also official routers in place. We realized also along the way that is not even sufficient in some of the communities because they are not very much efficient. The signals are very low. That being the case, the program has also gone further to say that we will assign Intersat to provide satellite internet connectivity in remote communities, particularly the areas we'll be doing in our next phase, where signals from Senegal are the one you can even have than that of the Gambia. So that shows that the coverage of internet is an issue, is a national issue, beyond the program's limit. But we are doing all efforts to ensure that our service is available and is readily available in all the communities. That being the case, there will be mop-up in some of the communities. We may call it a second round 2. And also there's a target for all the institutions that are operating. Will visit them one day and provide a service for them, so they will also have access to the service. Because we know some of the institutions, they don't have the time to go and be queuing in the community to provide this service. Furthermore, the service has come to stay. There will be routine service that will be continuing after this campaign, because we have already equipped all health facilities. 79 registration centers are already being provided in the whole country, and we have 258 outlets that will be providing services. We have desktops provided in all these 79 centers, and also we have adequate more than 350 laptops are available. We had more than almost nearly the same number of tablets that will be used in terms of data collection from remote areas. But as we link in now directly to the system, this campaign, you need to wait on spot because we give people certificate on spot. That is the big picture. But on the routine service, you will come, your data will be collected, and you will be asked to come when to pick it. So that will be another burden. So there shouldn't be any panic. People shouldn't rush. Should come to the clinic, register now, because it's an opportunity. But let them be assured that now the service will continue. It has come to stay. This is just honoring the communities, the resilience in terms of national documentation. So that's why the program is coming to them to approach them at the community level, provide this service for them. But it has come to stay, and it will continue to stay. And sometimes some of the communities will be highlighting that they are not being included. This one is a holistic inclusion. Everybody is on board. And then the slogan for civil registration is no one to be left behind. No one to be left behind. Everybody is included. That's why we are registering refugees. We are registering even those born outside the Gambia. So we cater everybody. We're not leaving anybody out, and we are asking everybody to be. Some communities, we have some challenges in terms of their database. And what we realize, the name we have in our database for their communities, they have different names of those communities. Some communities have 3 or more names. And then sometimes some don't know their original names. But the current common names are the one they are using, and assuming that those are the legal documentations. I give a sample to many areas. For example, if you use Churchano as a community, in Oponyomi. Legally, or on the main master list, is Medina Bafulot. Just a sample. I also cite a sample of our community, for example, in Dobo, in Badibu. The original name is Bangaya, but now they're using Dobo because they are relocated from where they were to another nearby the forest that's called Dobo, and now they call the community as a Dobo. This is just a sample of, and some of the communities, for example, may have multiple names, and also some of the names will be in a cluster format, and then only one alkali. So these are all things that we have. Some of the communities are saying that they are not being included. No, we're not leaving any community behind. So any community that is having some of those things, we said, inshallah, there's a program in place that will be doing all the editing and also including all those missing that are not in the database, and they will be all included, and everybody on this one will be served. We realized that recently some of the demarcations had been done by the local government authorities, giving some communities autonomy, which were not known as before, because the database, for example, needs to be aligned with other sister bodies. Civil registration is cross-cutting issues. Our prime database, which was taken from the census list, that has done a good job going around the whole country. So these are the ones we are aligning to the local government list to provide the services to all communities in the country. But if you look, for example, the naming, how it has been by the people, and then what exists legally, I will give another sample of Latrikunda Yiringanya. Globally, some will call it now Latrikunda Jama to distinguish it with the Latrikunda Sabiji. In the books, Latrikunda Yiringanya is the community's name. But you see, sometimes you'll have some people say, where do you come from? They said, I come from Latrikunda Jama. No. And there are some communities that don't also have their alcalos. For example, if I ask people who is the alcalo of Kanifing South, nobody can tell me, very few can tell me. There's no alcalo in Kanifing South. The alcalo actually is the word of that of Latrikunda Yiringanya. Because this was a community belonging to Latrikunda Yiringanya, they moved from there and they relocated to where they are now. But the land and the territory all belong to Latrikunda Yiringanya. So these are some of the things that people find it difficult. Now they'll say, I have this on my document, and then why the database is not capturing in the way I want it. No. We need to clarify some of these things, but we are also working diligently with all necessary authorities, that the local government authorities, the GBOS, and the population secretariat, ensuring that all the people and all settlements are captured in the right and appropriate way. Likewise, sometimes in the database, the spelling may be different from what you want on your documents. People have different ways of spelling the names. Like, for example, Sifo. We've seen on the signboard